I decided to start my talk today with a picture of these four great Italian athletes, which are Gianmarco Tamberi, Antonella Palmisano, Massimo Stano, and Martina Caironi. Since they won gold and silver medals during the last Olympic and Paralympic Games in Tokyo. Of course, these athletes won those medals for their talent, for their commitment during the training in the last 5 years at least. But they also, it is important to me to share with you that they recognize the importance of sleep for their performances, because they were part of a working group together with me and Professor Antonio Latorre, which is the technical director of the Italian Track and Field Federation. And this working group was focused on sleep monitoring and sleep management. So I think that one of the key messages it is that it is very important that now finally top level athletes are working on their sleep, aiming to improve their performances, their health, and to possibly reduce the risk of injury. So I think that it was a good way to start the talk of today. So this is the general outline of my presentation, the daily program. I will have a first few minutes of theoretic information about chronobiology, sleep pressure, and adenosine, because I think that the best way to approach the sleep problem with athletes is the chronobiologic approach. So we will talk about day and night, light and darkness, and how the circadian variation of performances are strongly related to the athlete sleep. And then we will talk in the core part of the presentation about the sleep of elite athletes in general. So we will talk about the factors able to influence their sleep. We will have a focus on the late evening competition and the possible effect of late evening competition on sleep architecture. We will share some information about the methods for sleep assessments, the pros and cons of different methods, and then also focus on how sleep restriction, acute sleep restriction, can impact the athlete's performances. And then in the last part of the presentation, I will share with you some possible solutions to sleep problems or sleep restrictions. So I will talk to you about sleep hygiene strategies, but most of all, I will focus my talk on the effect of napping. So we will try to answer to the question to nap or not to nap, and why to nap and when to nap. So let's say that okay, chronobiology is the science studies biological rhythms in humans. Of course, we can recognize different rhythms in humans. So, of course, circadian rhythms related to a 24-hour periods, ultradian rhythms shorter than 20 hours, and infradian rhythms, so longer than 28 hours. For example, in a study, we observe a circannual rhythm, a rhythm that lasts 1 year, of vitamin D and cortisol and testosterone in top-level soccer players in Italy. We have to know that our rhythms are controlled by endogenous and exogenous components. The endogenous component is our, let's say, body clock. Our body clock is located in the suprachiasmatic nucleus of the hypothalamus, but also our peripheral tissues and muscles too shows an autonomous rhythmicity. But the endogenous component is regulated by exogenous external factors. In chronobiology, these external factors are called synchronizers. And what's most important for us today is to know that the primary synchronizer in human is the light-dark cycle. So why light is so important for our circadian expression and for our sleep? Because light stimulates the wake center within our brain. So, for example, light can inhibit the melatonin production, and as you know, melatonin is an hormone promoting sleep, and also the light information, the light exposure can send a message through our eye to our brain, and this increase the glutamate release within our brain, and glutamate is one of the most important excitatory neurotransmitter in our brain, and this ultimately lead to an increase in our neuronal and dopaminergic activity. So lights literally wakes you up. And sleep and biological rhythms are really strongly linked each other, and this is very easy to understand when we look, for example, at the circadian rhythm of many hormones. For example, as you can see here in the slide about the circadian rhythm of melatonin and cortisol. Especially at the beginning and at the end of the sleeping period, we can observe a strong hormonal response of these hormones, because, for example, when we start to sleep, we lower our body temperature, which is another variable that shows strong circadian variation. We start to increase our melatonin production that promotes sleep, and also during the night we observe lower level of cortisol. And on the other end, when we wake up, about 30 minutes after waking up, we observe the peak of our cortisol circadian rhythm, and that is called the cortisol awakening response. But this actually happens, for example, in healthy controls that sleep well in terms of quality and quantity. But it is also important to say that in people, for example, affected by insomnia, as you can see here again, the circadian rhythm of cortisol is totally lost. We observe flattened circadian rhythm of cortisol with higher level of cortisol during the day, especially during the night, and this in chronic condition can have, of course, several negative consequences for health and performances, and of course for athletes too. And this is also true for other anabolic hormone, for example, the growth hormone, which reaches the peak in the first part of a sleeping period if you sleep in a normal way, let's say this, but in a sleep deprivation condition, the typical circadian pulsatility of this growth hormone, which is very important for also for our muscle metabolism, for example, is totally lost. So sleeping to sleep in a correct way is also very important for our circadian expression. So to stress again one more time this concept, this is the two-process model of sleep regulation, which is one of the most cited and presented model for sleep regulation in the scientific literature. And in this model, the process S and the process C works together to guarantee the correct sleep architecture. The process C is our circadian rhythmicity, and one of the marker of the process C is any of our hormones showing a circadian variability, for example, melatonin, or as we said, cortisol, growth hormone, and so on. While the process S is represents the sleep pressure or the sleep depth, And one of the marker of the process S within this model is, for example, adenosine. And to me, it's important to spend few words on adenosine, because adenosine is actually a nucleoside, ubiquitous nucleoside, but it is also considered a sleep factor because it is involved in the regulation of sleep, and also it is known to accumulate within the brain, adenosine, during long period of wakefulness of after sleep deprivation of sleep restriction. So higher adenosine in our brain lead to lower glutamate release. That and if you remember, as we said just few slides before, it is an excitatory neurotransmitters, and this ultimately leads to a lower neuronal and dopamine activity, and to a higher sense of sleepiness during the day. And these physiological functions and mechanism of adenosine are crucial even more crucial in some specific area of our brain, for example, in the anterior cingulate cortex, which is an area that is involved, for example, in self-regulation of perceived exertion. And as you know, perceived exertion can be one of the limiting factor of our athletes' performances. So we need to know this physiological mechanism. And also, as you can see on the right side of the slide, caffeine, which has a molecular structure that is quite similar to caffeine, can bind to cell membrane receptors for adenosine, thus blocking direction. So caffeine wakes us up because caffeine can inhibit the inhibitory effect of adenosine in our brain. So just to conclude this first theoretical part, we can say that, as you can see in this diagram, this is one of the possible physiological effects dictated by sleep deprivation that can explain the decrease in lower performances in our athletes. So an increase in adenosine that leads to a lower dopamine level and to a higher perceived exertion during and lower motivation during performances. So now let's talk directly about sleep. When dealing and studying sleep, we need to consider three main key variables, which are timing. So when to go to bed and when to wake up, quantity and quality of sleep. For example, the National Sleep Foundation said that young adults and adults should sleep between 7 or 9 hours during the day, but the amount or the quantity of sleep is not enough to describe the correct sleep behavior, because we need also to consider the correct sleep quality, or so the sleep architecture. And one of the let's say the most important variable for sleep quality is sleep efficiency, that actually is the actual sleep during the night that an athlete can reach, that a human can reach, and sleep efficiency needs to be higher than 85%. So let's say that if one of my athletes sleep at least 7 hours with at least 85% of sleep efficiency, I can be, let's say, happy. If not, maybe there is some problem, and so I have to find some possible solutions. So which are the physiological role of sleep in athletes? We already discussed about some of these functions, but we can stress it again and find some new functions of sleep for athletes. If we consider our brain, sleep is essential for, of course, memory, learning, decision making, or reaction time, but also problem solving and so on. So it is important to sleep well also for the brain of our athletes. Another key variable is the emotional regulation in general. And for example, anxiety and depression are strongly related to sleep, because higher level of anxiety can impact sleep, but also if I sleep less than the expected amount or the recommended amount of sleep, I can have the day after higher level of anxiety. So sleep has a key role for our emotions and our emotional regulation in general. And then last but not least, sleep can regulate a lot, really a lot of physiological function that are strongly related to the athlete's performances. As we said before, sleep can lower the cortisol level, increase the anabolic hormone response in terms of testosterone, growth hormone. A recent study shows that sleep can increase the myofibrillar protein synthesis in response to a sleep restriction period, for example, but it can also regulate blood pressure, the heart rate variability, the immune system in general, and so on. So as you can easily understand, sleep is really essential. Is a biological process that has many functions that cannot be ignored if you want to have our athlete in a healthy condition and if you want them to perform at their peak performances. But now the question can be, how do athletes actually sleep? In the scientific literature, it is said that athletes should, or actually would love to sleep a little bit more than, let's say, normal people. So they would like to sleep between 8 and 10 hours per night, but they actually sleep much less. We are still waiting to read some papers on the sleep of athletes during the last Olympic Games, but a previous study shows that the 75% of Olympic athletes that were part of the Rio of the Brazilian Olympic Games in 2016 slept than less than 7 hours. So they did not reach the minimum level of sleep quantity. And also, we need to consider some background variables that can impact the sleep of the athletes. For example, the sport disciplines can have a role for sleep. For example, it is widely recognized that team sport athletes such as soccer, basketball, cricket, or volleyball players shows a higher predisposition toward eveningness. They are more evening type, so they tend to go to sleep, to go to bed, and to wake up later in the day, and they show in general delayed sleep-wake cycle. Whereas individual sport athletes such as track and field, swimmer, triathlon athletes or runners are more morning oriented, so they typically tend to wake up and to compete, to train, and to go to bed earlier during the day, and they have typically a lower sleep quality than team sport players in general, let's say. And also, this is of course true, also true for the general population. We need to know that there are some gender differences, and in general, men can sleep a little bit better than women, and men are in general more evening oriented, so the chronotype is typically shifted toward eveningness for men and a little bit more toward morningness for female athletes. Anyway, we have to know that the sleep is very shows a very high intra and inter-individual variability, and this is very well documented in the scientific literature. And in this slide, I would like to share with you the data of 3 sleep parameters of the Italian Olympic Evos that participated in Tokyo 2020. These 3 parameters are the sleep efficiency, the total sleep time, and the sleep onset latency that represents the time needed to fall asleep after bedtime. Okay, and each horizontal histograms represent a single athlete, and each blue circle represent one single night. And as you can easily see with your eyes, the sleep parameters show a very large variability intra-individual, but also inter-individual, because athlete 1 sleep in a different way that athlete 5, for example. But if we look inside each single athlete, the sleep parameters can be really different, okay, during the different nights. And this was a baseline sleep monitoring. I mean, in a period of, let's say, in a pre-season period with no competition, with no long travel, and so on. So if we know that, we need to know, we can easily understand that for such high variability, we need to find then variable and individual solution with our athletes. Okay. Let's spend now a few words on the assessments method for sleep in general, but for athletes in specific. We need to collect both subjective and objective data. Both these 2 data are essential. If we have only one of these 2 data, only subjective or objective, it is not enough. For the subjective assessments, we have a lot of scales, questionnaires, or sleep diaries validated in many languages, and so there are also 2 sport-specific questionnaires, and so they can be easily used with our athletes. And for the objective evaluation of sleep, we can identify 2 main methods, which are the polysomnography and the actigraphy. But actually, polysomnography requires hospitalization, familiarization, and it is not so easy to adopt polysomnography to study sleep with top-level athletes. So the best, this is my personal opinion, but today the best option is still actigraphy. So actigraphs are 3-axis accelerometers that can be easily delivered to athletes. They can collect data for many days, up to 3 months, 3 consecutive months. It is actually a medical device used for diagnosis in clinics and in research. It is a valid sleep assessment tool if compared to polysomnography. But what's most important to say is that I can collect data of sleep, of athlete sleep in a real life condition. So I can collect data of an athlete sleep while he is or she is sleeping at home, while he is sleeping in the other side of the world. I can also have data about their napping and so on. And for example, here I reported in this slide an image of an actogram of an Italian Olympic athlete that joined the last Olympic Games. And as you can see, I can have data of sleep in different, for many days, okay? We typically collect data for a minimum of 2 weeks and a maximum of 6 consecutive weeks, many times during the competitive season, but I can also observe sleep data and the sleep-wake cycles in general in different conditions. And now probably we are in a transition phase toward these new generation devices, which are not again so comfortable as Actigraphy. So probably now Actigraphy, as I said before, is the best choice for sleep assessment in athletes. So now, which are the typical factors? Let's talk about the typical factors that can influence sleep. We already mentioned some of these. So light exposure, of course, is the primary synchronizer. So light exposure, especially in the evening, can negatively impact sleep. We have stress and anxiety, especially related to competition, that can have a detrimental effect on sleep, and this can be managed in a correct way. One key variable is that many athletes do not even recognize the importance of sleep for their performances or health. So the first things to do is to plan education session and to share knowledge on sleep, because this is the first, and I think that this is the first step to do with our athletes. Of course, we have the problem of electronic devices and social media, especially with young athletes. The problem of their sleep is typically in their hands, and so we need to strongly consider this factor. We have, of course, long-haul travels and jet-lag symptoms for international competition. Unfortunately, we don't have enough time to talk about this big variable today, but need, of course, to be considered and to be managed in the correct way, also with the physician of our athletes. And again, caffeine and alcohol consumption need to be correctly managed, and also some factors are also related to training. So if we would like to focus now on training, these are the main training variables that are able to negatively affect the sleep of our athletes. So, for example, altitude and hypoxia, especially higher than 2,000 meters, can lead to some sleep disturbances, especially in the first 2-3 days of training at high altitude. We have also duration and intensity of the training that defines the training load that can negatively impact sleep. I mean that higher and fast variation of the training load inside a week, a weekly training, for example, can lead to some sleep disturbances. So we need to pay attention to the volume of the training. And also we have 3 main variable sports disciplines, as we said before, or the time of the day, or the habitual training time that are related to the athlete's chronotype that need to be studied and controlled if we want to avoid some sleep problems of our athletes. And for example, I think that is nice and important to talk about the possible effect of night competition on sleep, because, for example, in Italy, many soccer players after a night match report that they cannot even sleep after the competition, and this is explained by some behavioral and environmental factors, such as the high level of light exposure inside the stadium, higher level of arousal, psychological arousal and excitement, of course, because playing in front of 80,000 people can lead to such consequences, and also having a high intensity physical performances during close to bedtime can increase the body temperature, the circulating cortisol level, and so on. And these are all physiological factors that can disturb sleep in athletes. But actually, this is not always true. Why I'm saying this? Because, for example, in this study, we analyzed the effect of a late evening match in elite team sport athletes, and we collected data with new generation device for sleep detection. And what we observe is that if we have, after a night competition, a delayed bedtime, the sleep architecture of that night following competition is not negatively impacted. So the time between exercise or competition stop, or the end of the competition, and bedtime is crucial if we want to have our athletes to sleep in a correct way. So it is important not to send our athletes to bed early after a night competition, but we need to let them go and have a dinner, have a shower, to do some social activities after the night competition, and then they can, of course, delay the bedtime, but this can be a protective factor for their sleep. Now, before going into the solution, I would like to share with you just two studies that we perform aiming to assess the effect of acute sleep restriction on sleep performances. In this study, for example, we actually investigated the effect of single and combined the single and combined effects of sleep restriction and mental fatigue on free throw performances in basketball players. So what we have done, we ask players to perform 60 free throws. Then all players watch a 30-minute video aiming to with a sport-specific component. So they watched a video on basketball tactics, and they have to also answer to a questionnaire trying to understand if they were focused on this video. The aim of this was to increase their mental fatigue, and they throw again 60 free throws. This happened in two different conditions: in a normal sleep condition and in a sleep restriction condition, when where we asked them to sleep less than 5 hours per night, only for one night, okay, the night preceding the test. So what we observed, what the visual analog scale for mental fatigue was, these values was higher in the three condition when compared to the control condition. The three conditions are mental fatigue, sleep restriction, and the combination of sleep restriction and mental fatigue. But what's most important is that we observe in these three experimental conditions a drop of 7% of the free throw accuracy. So just one night of sleep restriction can negatively impact the performances of basketball players. And if we consider that the free throws represent the 20-30% of the total score of a basketball game, I think that is a crucial data to know and to understand. In a similar study, we try to investigate the effect of acute sleep restriction in junior tennis players, and again here we observe a negative strong impact of sleep restriction on serve accuracy and cross-court forehand and backhand accuracy, but not on the ability of the players to perform repeated sprints, for example. So we concluded that probably acute sleep restriction is able to affect some and not all the performances of the athletes, and especially sleep restriction can impact those performances that involve a higher technical and cognitive demands than the classical athletic performances, just such as a sprint. So sleep restricted tennis players can run in an efficiency way, but probably the accuracy of their shot of the shot could be a little bit worsen or lower. Okay, now in the last 5 minutes, I'm going to share with you some possible solutions to sleep restriction or sleep problems in athletes. Of course, we know that some of a possible solution is always represented by pharmacological intervention, and this has to be shared, of course, with the physician and the medical staff of the athlete. But we work on a different, let's say, in parallel in a different way. We typically work on sleep hygiene strategies, which are some behavioral strategies that are possibly able to positively affect the athlete's sleep. They are typically classified in 3 main categories that refer to the optimization of the bedroom, setting a sleep schedule and a nightly routine, and adopt an healthy daylight habits. And I don't want to spend a lot of time on each single sleep hygiene strategies, but I would like to share with you some data that we collected again with our track and field Olympic level athletes of the Italian Track and Field Federation, because as you can see here, we of course work with them adopting sleep hygiene strategies for in a chronic manner, let's say for more than 1 week, for more than 1 consecutive weeks. And here I share with you the data on sleep efficiency and sleep onset latency. And as you can see in the SHS, so the sleep hygiene strategy condition, we observe higher level of sleep efficiency and lower sleep onset latency, which is good. And also, if you look at the standard deviation of these 2 histograms, you can see that they are shorter in the sleep hygiene strategies condition. So we really observe a strong and a positive effect of such strategies on sleep, on some of the sleep parameters of our athletes. And now, going through the end, let's spend some words on napping. So the question is to nap or not to nap. Nap is a really strong weapon, and as all the strong weapon can be also a little bit dangerous. So we need to manage napping in the correct way. And we started to try to answer to this question when I was with, for example, with Shona Hasson, Mathieu Nedelec, Michele Lastella, and other excellent colleagues in Vancouver during the World Sleep Congress. And we tried we had a deal. I mean, we planned to perform a systematic review on this specific topic, trying to understand if napping was really effective, is really effective for athletes. And again here, as you can see, napping, just to share some preliminary key information, is a strategy that is very often used by athletes to recover after a sleep restriction period, or in general, athletes tend to nap a lot during the day. So we need to know when to nap and how long the nap should be if we want to have an effective nap for athletes' performances. So key info on napping are these. So first of all, we can classify nap in prophylactic, recovery, and appetitive nap. So the prophylactic nap is in a provision of a sleep restriction period. The recovery nap is in response to a sleep restriction period, and the appetitive nap is just for joy, let's say. If you remember, at the beginning of the presentation, we talked about adenosine, which is known to accumulate within the brain after sleep restriction or sleep deprivation or during long periods of wakefulness. But experimental studies said that napping is able to lower our adenosine level within the brain. So a physiological and real effect is actually observed. So this is the basis to work on napping, of course. But if we want to have an nap that is effective, we need to consider both duration and timing. So as you can see here, duration is crucial because brief, short or long nap can have, for example, on our cognitive function, a positive effect, of course, and this is a good news for us. But if if we adopt a brief nap, a very brief nap, the positive effect is very, very fast. But if we adopt, for example, if we adopt a short or a longer nap, yes, we can reach higher cognitive function, for example, as you can see here, but we observe also an initial decrease of our cognitive function after awaking from a nap. So, and this first decrease of the cognitive function of the human performance after a long nap is explained by the sleep inertia. So that sense of grogginess that we experience after waking up following a nap. So, and this cannot be ignored, of course. And then timing. On the other hand, timing. This graph is a little bit more complicated, but it tells us that that napping at 10 a.m. or at 6 p.m. is totally different for this sleep architecture within the nap period, but also napping late in the evening can have a negative effect on the sleep architecture of the following night. So we need to pay attention also to the timing. So going through the end, and this is the last slide. These are the results of our systematic reviews. The results are important because we can be sure to say that napping has a beneficial effect on physical and cognitive performances, on perceptual measure, on the psychological state, also on nighttime sleep of our athletes. And this is true only if we respect the three golden rules for napping. So we need to consider timing, which has to be between 1 and 4 p.m. So that in this way, napping is has not a negative effect on the following night sleep. Also, nap should consider to nap between 20 and 90 minutes. And anyway, they athletes should allow 30 minutes to reduce the sleep inertia prior to training or competition again following nap. So all these rules makes the nap very effective. Okay, I would like to thank you, everybody, for the attention. And if there are some questions, I hope to be able to answer to your question and doubts. Thank you so much.